My friends, so welcome to our, I would almost call it an informal workshop, just a small moment of our project, SHIA, that is going to start, well, officially it started in the 1st of January, but we will have our kickoff only in Lisbon in 2 weeks' time. So we are still sort of warming up our engines, as you can see. But in any case, welcome those on site and online. And basically, the discussion here is how can we keep healthcare providers and healthcare professionals with skills to navigate this digital health landscape. So the philosophy for our workshop today is going to be my most recent invention: exchange ideas, improvise, innovate, and interoperate. So not necessarily everything has been decided. So just keep discussion going and be flexible. This is the spirit with which we want to start this project. We will have, I'll just quickly present the project in a few minutes, and then I'll give the word to John and provide an introduction to the project. Then we will have a discussion, interactive stakeholder session, where we want to hear from Alexander, from Juliana on site, from past experience projects from ISCTE, and then Katerina from a company, and then have a Q&A discussion session. So without more, because I will have time to come back to the SHIA and tell you a little bit about it, I would like to invite Professor John Mantas to give us his keynote on why interoperability education matters for Europe's digital health future. Thank you, John.
Thank you very much, Henrique, for the introduction. I hope I can be heard. Okay, I hope so. So, first of all, thank you for the honor, for the invitation to join this first workshop of this very important, I think, project of an education of interoperability, an idea that started a couple of years ago, that Henrique was the master of organizing such a big consortium of colleagues related to the field of education, and under Erasmus, he managed to accomplish such an important task. For me, it's a great honor to have you also here in Athens. I'm a professor of health informatics at the University of Athens. I hope you have visited the nice center of Athens, where you have the building of the opening of all the ceremonies are happening there. And also, I'm privileged to be also in EFMI as chair of the Certification Accreditation Committee. And as part of EFMI, as partners within the project, would like to thank you again for this honor to be here in this presentation. So, first of all, a few words about interoperability. We know that it's the most important thing that has to be done and to be accomplished in the field of digital health. Interoperability between digital health solutions is fundamental to allow health data to be used and reused in ways that enhance health and healthcare for European citizens, that crosses health institutions, healthcare institutions, and crosses around countries, and also has to be according to the rules of the European Union. Interoperability starts and ends in people. We, people, are involved in interoperability. We are going to gain all the benefits of interoperability. So it's a person's issue. If those creating, buying, adapting, and adopting digital health solutions do not know about interoperability standards in a progressively advanced manner, these solutions, especially electronic healthcare records, will never really interconnect and allow seamless flow of health data to ensure best care for everyone in Europe. It is a real must, and in order to be accomplished, it's not a technical solution only, but it's also a healthcare professions and the people's responsibility to be educated, learn, and implement the interoperability for the best of the healthcare system. So the people involved with the design, development, implementation, and use must equally be upskilled. We know that the educational system, especially the healthcare, takes some time to absorb and takes new things happening in the technical world. And we need a continuing education to cover this at many stages, and also not only the healthcare professions, but also those implementing the development of applications, as well as the persons involved to take advantage of the interoperability applications. The digital transformation of healthcare is a process to be led by well-trained clinical and technical workforce. Both have to be trained in this field. We know that the European health data space aims to facilitate data exchange between countries. Given that this data is generated by millions of professionals, it is essential to establish training measures at various levels to ensure a common understanding of data interoperability. So it's an important task that this project, the ZIA project, is going to be used across Europe to implement this great educational approach. So it is interoperability education and not education interoperability. So be careful of this terminology. It's a different thing. So we're speaking for this, in this term about interoperability education. So some historical background in the field of medical informatics, because we are part of medical informatics and health informatics, as we call it nowadays, because we are living the application side, which is the digital health. Everything started after the invention of computers. We have the terminology computers in medicine. We have the evolution of medical informatics in the 60s, and the evolution of imaging applications, of the early imaging applications. We have organizations that developed and bring together the experts in the field of medical informatics in IMIA, which is the International Medical Informatics Association, and EFMI, 1970s. And both organizations developed educational working groups because they thought from the early beginning that education plays a very important role in implementing the field of medical informatics or digital health as we know now. The German association, Regensburg, developed official recommendations how we are going to educate the new generation at that time of healthcare professions. And this is very important because this has been already degraded in the international associations, and these recommendations is the first step for international recommendations. We have a European approach for the Erasmus, the late 80s, which is after the Maastricht Treaty. We have the implementation of Erasmus across Europe. We have, for the first time, the introduction of the term health informatics in this country, in this university, University of Athens, that has developed the first European Erasmus Master Health Informatics program with the cooperation of 20 universities at the late 80s, 89, 90. We have at that time, because of this program, the first recommendation by the Council of Europe that we need to include medical informatics applications and courses in the curricula of medical schools and nursing schools, which is still a very difficult task to change the curriculum in medical schools to accommodate digital health courses. So why are education documentations needed? Because we'd like to have a uniform way of presenting the field. The terminology plays an important role, as well as the competency that we are going to make the implementation across countries and across Europe, for example. And also we have to make sure that the quality of those programs are of high standard. So the International Medical Informatics Association developed many times educational recommendations. The first ones came in the 2000, and this published by the famous paper at that time. And also we have recommendations of the educational curricula in 2010, and the recent ones are 2023. So they take into account the new terminology, the new applications, and the new fields that have arisen, like, for example, the artificial intelligence. But also, as we know, artificial intelligence is not a new one, it's an old one, but it has to be reinvented these years and be applied because of too many data, which is very important for applications of artificial intelligence, but also very high computing. So this now is possible to make the implementation possible. So we need to be educated also in this field with the curriculum. How these recommendations were developed of 2023, 45 very high caliber scientists and educators from the EMEA world were assembled for many years, about 2 or 3 years, representing various countries and continents, participated in different meetings, and also at the end a task force make the implementation possible by writing up the recommendations and getting the approval of the EMEA General Assembly. So for 2023, we have the new recommendations. So I invite you to go and visit the EMEA website and download the recommendations. It's a very, very important document for any educational application in the field. The differences between the previous recommendations and the current ones is that the domains now are defined as in 6 domains. So we have the core principles in medical informatics, the health science and services. We have computer data and information science. Somewhere there is also interoperability, social and behavioral sciences, management sciences, and BMI specialization, which includes, of course, artificial intelligence. This is the famous now schema that we're using to make to show the biomedical informatics field, the digital health field, and with the 6 domains. So we introduce 3 levels of roles in the field. We have the user, which is very important. I think most of what we're going to discuss in this project is about the user level. We have the generalist, which sits between the healthcare profession and the institution, and also the implementation phase. So it's like a liaison between the technical world and the healthcare world. And the specialist, which is a researcher in the field, and it's quite a lot of knowledge to reach the research level. And also we have this schema, which is like a pyramid. I don't know if it's shown very well here, but yes. So we have the schema that the user is in the field of the lower level in terms of knowledge. It combines the knowledge of health science, computer science, and healthcare information management, but also it can reach the level of an undergraduate, the first year or second year of undergraduate. And also we have the second level, which is the generalist. Usually it is a graduate of a program in digital health and also a master's in the field. And the specialist, usually it is a research-driven master's and a PhD. So this is the definition according to EMEA of the roles in digital health. So in conclusion for this EMEA part, the educational needs are described in 3 roles. As mentioned before, the domains are 6, as described in the schema. The recommendation provided for dedicated biomedical informatics programs in an undergraduate and postgraduate level. So we are speaking about the academic level. The implementation of the recommendations can be applied in training programs and small programs dedicated to special institutions and healthcare domains. But mostly the description of those recommendations are dedicated to the academic fields. And regular revision, of course, is required in order to be updated as regular as possible. So from EFMI's point of view, now I'm moving now to the European area of European Federation of Medical Informatics. There is an initiative for accreditation and certification. So we try to control the quality of the programs that have been implemented in Europe. As you know, it is a very important thing, the quality of education. is of paramount importance, ensuring adequate knowledge and skills, and this monitoring should be applied from the very beginning of education, so it's preemptive, developing the quality pathway towards capacity building of professionals by medical and health informatics, or as we call it for the application side, the digital health. So we have developed a committee, this is the 7 people nowadays in FME that are discussing the accreditation process, and they're very well known, as you see. And for the accreditation, you should know there's a very diligent evaluation and monitoring of peer review process, ensuring that the education programs and institutions meet academic standards and operational integrity and quality. And it provides to them, to the programs, a European added value by experts in the field. Because, as you know, according to the rules of higher education in Europe, we need to have accreditation of programs by the ministries of education, in any case. But those accreditations are more generic in terms of quality of infrastructure and following the rules of the law. But according to FME, we are going deep to see if the academic quality of the program is of adequate quality in terms of implementation of the recommendations. So we have 5 criteria of assessment. The needs and relevance of the program. If it is okay, it receives an okay. The second criteria is the intended learning outcomes. Have to be described fully. If they're okay, then it's okay. The academic teaching learning environment, so evaluating the environment and the academic personnel and the teachers. The organization and implementation, also very high importance. And also if the program itself has a quality assurance and development to support any issues that have arisen within the implementation of the program. If the five criteria are okay, then the program receives the accreditation certification. If 4 criteria are observed and not 1, then it gives a warning that we can give the accreditation only for 1 year, and then the committee has to revisit the program to see if the corrections have been made. So it's a strict procedure, as you all know about the accreditation procedure. The dean, the head of department has to be involved, the program director, all the faculty staff quality managers have to be interviewed, the students themselves have to give the opinion to the committees of evaluation, the alumni are involved, the stakeholders, to see if this program is just for the academic world or is involved within the community and makes an application to the community, which is very important, not to live in an island, you have to live in the real world. The individual panel reports to the individually, then a consensus report is developed, and the consensus report has to be approved by the committee and the board of FME. Then the accreditation is provided. So for interoperability education, we need to educate a large force across health systems in advanced interoperability standards, the healthcare professionals, the IT professionals, the new occupations that are involved in the field. That's really important, and we have to not to leave somebody else, should not be, how we call it, a niche approach, but has to be across the layman's as well. Create educators network to fluently implement micro-credentials element of degree of education. You have to establish a dynamic pan-European alliance, an ecosystem of doers and change makers for the sustainability, to update and lasting impact for the education for the next generation workforce in Europe. We also need to spiral up the educational experiences to larger ecosystem, promoting immersive educational experiences that foster the network of alumni as change engines, and explore existing networks like Hospitals on Fire and networks of medical informatics educators across Europe to galvanize efforts towards cross-border interoperability in health. Also, we need to ensure high-quality training and education through accreditation and quality assurance credentialing measures based on international and European standards. So the project itself that Henrique will present, is dedicated to advancing interoperability within the healthcare sector, particularly in anticipation of the European Health Data Space Regulation, through a comprehensive education initiative. ZIA aims to address the skills-up gap in advanced digital health interoperability standards among healthcare providers, digital health solution providers, and of course, individuals. So I'd like to thank you very much, and I think you can continue now for the presentation of the entire project. Thank you.
Any immediate question for John?
Alexander, you have a question.
Or online? Any immediate question?
Yeah, I have a question.
Yes,
Yeah, go
please.
ahead.
So what's the time frame? I wanted to know what's the time frame that the whole accreditation starts from start to finish? How long does that take?
About the project?
Yeah.
No, for the accreditation.
Yes, first of all, if you are a program director, usually this program director initiates the procedure. You go back to your dean. You ask, do you allow me to make accreditation of my program? Do we have the resources to do? So they have to meet at the dean's school, senate, whatever, to approve that they need accreditation. So you have to give the backup of the whole hierarchy. That's important. Second, then you send the letter to EFMI. EFMI board sees the procedure that this is a valid institution, approves it, and then the committee starts. How much time we need? Usually we're very fast from EFMI points of view. It depends on the university sometimes. It's some bureaucracy. Then the procedure starts. I mean, in 2 weeks, we have the 3 members committee. Now, what we request from them? That they are going to ask time plan from the university about the interviews. So you have to mobilize as program director, if you are a university or institution, to see how many alumni you are going to bring. Where are the students? You have to give them some instructions. Then you have to make appointments with all the academic staff. So if you have this agreement by every party, then you make a time plan and send it to EFMI. EFMI sees the time plan, says, okay, this is a possibility for the 3 members to visit. It's not easy. Can we rearrange in another meeting some days later? So they have to agree about the dates. It's very easy. Usually whatever EFMI suggests, they accept it because they applied. And then starts the review. So before, we had to travel to the destination to make the review on site. Now we can do it like that. Then, if we do that like that, you have to prepare videos of the infrastructure, videos of the library, videos of the laboratories, videos of the classes, videos live how you are teaching. So you can have the evaluation with evidence. You cannot have it just a document that arrives to us. And then the self-assessment report is the most important. You have to describe, as program director, first of all, what is the objective of the program? All the programs are not masters or undergraduate in digital health. They have some application, digital health in the community, digital health for interoperability. So the objective reflects the curriculum. If the objective is about space exploration and the curriculum is about something else, then of course the evaluation will be very negative. So you have to reflect this. And then is the program related to the stakeholders? Is the hospitals involved? Are the hospitals involved in the curriculum? Are they receiving the graduates for the thesis and work and the research work? So this kind of things are the criteria for evaluation. And then it's very, very easy. If you have done all this beforehand, then you should apply. If you're thinking that you apply and see what happens, usually it's not a nice outcome. So it can be done in 4 to 6 months overall.
One academic year.
Yeah, but we have some things like IMIA that can take one other year to make the approval of the whole procedure. Sometimes the bureaucracy comes also from our side. Any other question?
Okay, I think we move to the next topic, then we go to the discussion and we can come back. Okay, so on me, a little bit a quick overview of the project. Of course, some of you are very familiar, some of you are partners. Others may not be so familiar, so I think useful to, well, also for us to train as we get along. The first thing I wanted to say, if I had the chance to change the slides, is that, as you saw from John's slide, there's this undergraduate education and master's and PhD. Something is missing there, because most healthcare professionals and IT professionals, they are not going to do none of them to get updated on the new standards. So our starting point was to think, okay, how can we best prepare organizations, and who within organizations do we need to prepare on advanced interoperability skills that allow the European health data space to really come to fruition. So who is the consortium? So the Expanding Innovative Alliance is an Erasmus Plus action. So it's an education alliance type of initiative. It aims to develop and deploy high-quality courses. Now, one of the challenges that we discussed throughout the design of the project and then now in the implementation phase is, okay, but are we going to offer the courses ourselves? Or are we going to stimulate universities and companies that have large enough training departments, for example, or even HIMSS and other organizations to sort of collaborate in this effort? And I think this is the reality, is that if we want to go, for example, under the ManageEdit track, which is a master that is run by 3 universities together, an online master, we're talking about training 120 people per year. And 120 people per year, that perhaps 20 or 30 of them might not have anything to do with decisions about the changes of the software or the implementation of what software is bought. So we thought, okay, first we will need to look at analysis of needs. So we will be exploring that in one of the work packages. And we know that one of the biggest problems is that people do have skills gaps, especially in interoperability. Industry people and healthcare provider people tend to live in quite different cultures and worlds, but funny enough, they will have to learn the same type of topics if we are to really implement the electronic health record exchange format and other elements of interoperability that is within the spirit of the European health data space. I mean, different types of challenges. Okay, I'm not going to go through all the slides. You can read them at your time. And these slides, of course, will be available for all participants. So SHIA focuses on enhancing the capacity of healthcare providers and health IT provider enterprises, and indirectly many individuals, to adopt European health data space related to standards and embrace a culture of interoperability. So when looking back at what we wrote and seeing the evolution of this topic, it's not just the exchange format, it's not just the so-called, in the regulation, Article 5 and Article 6 interoperability component, but for example, the logging component and other aspects of interoperability that permeate the regulation. So one thing we know now is that even to cover well the topic, we might need to teach and prepare materials that are not just about the exchange format. And hence, and this is now a joke to Alexander, to make sure that he stays alert to my presentation, the X in SHIA is not for exchange, and it's not for exchange format, it's for the expanding. And the expanding here also means to expand the topics. So 3 ideas that I want to convey with this innovative alliance, in the sense that not downplaying the good work that John just presented. I was listening and I was thinking, okay, universities, programs, program directors, 2 years of application. If we go down this way, in 4 years' time, maybe we'll have, 10 masters around Europe accredited, capable. It's too long. We can't wait 4 years to train a significant amount of people. And why do you need to train a significant amount of people? Because if you don't train a significant amount of people in interoperability standards, you don't get what we call critical mass. You don't get at least 2 people in one company that are capable of discussing the exchange format domain of hospital letters or whatever. And you don't get, I give you numbers, some numbers that might surprise you. 14,000 hospitals in Europe. So even if you train one person in each hospital around Europe, the chief IT director, the chief CIO, just one, you'd still need to train 14,000 people just to cover all the hospitals. But it's not just the hospitals. You need at least one person per each company. Now I give you a rough estimation. Assume 100 companies, IT companies in Greece. Alexander, you know them almost all. Is this an unreasonable number? 100 companies on digital health.
I mean, if you
in Greece.
big ones and very small innovative ones, in
Yeah.
theory, yes.
Okay, well, we can count half of it if you prefer. But 100 is easier for my estimation.
Yeah.
So it's roughly 10 companies per million inhabitants. So for the entire Europe, we're talking about 340,000 companies. 3,400 companies. So topping the hospitals, just the hospitals and the companies, the national agencies, you quickly go to almost 20,000 people. Now, there's no way John would accredit a master program that would teach thousands of people in the old method. So the question is, can we go up to scale? And how can we go up to scale when people are actually busy in their work? They're not going to take 1 year off and do a master. They're not going to go all studying in the nighttime. So we started talking about this, and we came up with this idea of using small blocks of education content to sort of come up with a continuum of integrated education experience, which we need to foster. Now, I'm sure you've heard about this quadruple helix, or whatever helix you want to choose, but we chose this one, and just to highlight that in this alliance for innovative education efforts, we need industry. So our vision about industry is that industry is both a provider of education, so they may know more about, for example, implementing some standards. And this might be a paradox for some people, but it's not, because they are the ones that have the experience of doing the implementation. But also they have IT staff that needs education. So they can come up with content, but they also consume content. Public authorities, the same thing. You can think of public authority like the National Cyprus eHealth Authority that just presented in the morning their national EHR. As a consumer, they have IT people that need to learn about these standards. Same goes for SPMES, IDICA, many other organizations around Europe. But if you want a half an hour quick video, quick YouTube or TikTok video about one article that is relevant about the European health data space and relevant to digital health, maybe a good lawyer, maybe a good legal person from one of these public authorities can provide you that with in-depth knowledge, not just a theoretical presentation. Of course, academia is where we expect a lot of knowledge to come from, but also industry, SDOs, and then civil and professional associations, which again serve as a hybrid. For example, already for the kickoff, I'm going to jump these things. Already for the kickoff, we have talked with, I'm very enthusiastic about this thing. We talked with a branch of the European Radiology Society, which is a smaller radiologist society looking only on digital image. And they're going to talk at the kickoff. but they're also going to partner with SHIA to help us produce content for radiologists, but also use the content to teach radiologists. And what content are we talking about? Radiology imaging and radiology report. So within the exchange format, there's one domain that is specific about exchanges of images and the structuring of the report. So if we can work with them to come up with a structured report that is sponsored by the European Society of Radiology, then we have a clinical guideline and we have some education to back up. And that education does not need to be offered by academia. It can be offered by the medical society. And we believe that if it is offered by the medical society, it might be well received by the clinicians, much better than if it was offered by the digital agency of each country or from some other. This is just to give you time. So we have to work hard because in the first 6 months we have to kick off most work packages. And the first effort is going to be the pedagogical model. So we'll have some discussions on that, on the kickoff, and then of course we will do a workshop in April on the pedagogical model and this idea of micro-learning and micro-credits. What is micro-learning? Is to take half an hour, every morning you have half an hour drive or half an hour on the metro, you have a half an hour podcast or something which is organized. And you hear to this thing at your leisure, commas, at your other activity time, because it's not leisure. To be listening to an educational soundtrack or video should not be confused with leisure. This is where micro-certification comes. So if you're taking your time, and some people say, oh, that's ridiculous. People, okay, they take 2 hours a week to learn about interoperability. How can you certify that? This is where the concept of micro credits come from. So you add small credits, and maybe at the end of 2 months, you sum up a European credit ECT. Right? And you say, okay, then how many ECTs can you do? Well, you can do 12 ECTs per year. So in 2 years, you can do 24 ECTs, which is quite a lot if you think that, these guys are working, well, hopefully, to create the European health data space or to use it. And then, of course, we came up with a name. This is Key Advanced Interoperability Standards. This word means nothing or everything, because everything can be key and advanced. So examples, international patient summary, European format, global EHR, if we get to there. So any composite, any group of standards put together, profile, standards, testing, whatever, that functions to solve a problem, like sharing an international patient summary. That is what we are using as the concept of advanced interoperability standards. And then let me also remind you that we are also looking at aspects of digital transformation and cybersecurity. So it doesn't make any sense to talk about interoperability without talking about digital transformation. So if there's still paper, and in Greece, I'm sorry for the Greek colleagues in the room, there's still paper in the hospitals, a lot of paper. And paper is quite interoperable, actually. You just put one piece of paper on top of another piece of paper, and it looks pretty interoperable, right? I mean, you can just put a lot of paper together. As long as they are A4, they look interoperable. Do that with the American paper, which is not A4, is B4, and you immediately see that your paper record is not interoperable with an American record because just the size of the paper is not the same. Now, of course, this is not interoperability because you cannot move information between one piece of paper and another. So digital transformation is key to interoperability, not digitalization. Digital transformation. So if the processes are not interoperable and digitalized, there is no basis of interoperability. Because even if you want to be interoperable, you cannot. And then I always say, if you do all of this digital and you don't safeguard, you don't protect what you've done, one day someone will destroy. Someone will destroy with a cyber attack or with a cyber weakness because they were not careful to protect digital data, digital health data. And if you don't protect digital health data, you not only run the risk of privacy breaches, you even run the risk of patient risks. Okay, and so it's a responsibility. So over from me on this quick meteoric presentation of SHIA, okay, and now I think we move to other speakers. So I think we move to online speakers. But Alexander, this is now your panel. I don't know if you remember, but you're supposed now to moderate this panel where different people are going to do quick presentations, and then you have to put them to talk to each other. I'll remind you of the program because Alexander was not here. And I also don't know the program by heart.
More panel, it's okay.
Yes, yes, you can survive. So this slide was for you, okay? This is the new spirit of workshops. XI4, okay? Improvise, innovate, and interoperate. And now we move to, oh, actually I'm the moderator. So you're off the hook. You're just for the Q&A. So Juliana, I think but you're speaker. Now I remember why I was thinking. You're the speaker first. Alexander, over the stage is yours.
Well, I didn't prepare slides.
No, it's okay. Juliana, you can prepare to present from your side if you want, or if you want, we can move the slides from our side. But I think maybe from your side. Can we show the team's people? Okay. Go ahead.
So, I'm here with my Gnomon hat this time, right?
Yes.
So,
Well, also IHE hat is fine.
it's pretty much the same at some point. I think what is missing, and we discussed in the previous panel, and yesterday as well, the lack of capacity building. So we want to renovate whole healthcare around Europe, and we are not enough. So how are we going to do that? So one thing is to train people that are already in the cycle of healthcare on the different stakeholders and positions. So that's one thing. And one thing is to create new people that will create new professions. So I think the topic that John presented is more clear to the second. How to form people that will come and fill positions and new roles in a new connected society in healthcare, which was not the case 10 or 20 years ago. So this is something that we need to address very formally with curriculums, with universities and all these things, PhDs and research and all this stuff. The other topic, which I think is of interest of SHIA, is how can we fast track the knowledge of people that are currently in the system, and that we have to address a huge amount of work on their shoulders to do, on one hand, the job that they have to do every day, plus the whatever digital transformation they will contribute or be forced to do. So, I mean, there is a difference there, because if they can contribute, obviously this is going to go better. If they are forced to do that, I mean, we're living in Greece, we see it all the time. They don't react very well to this type of transformation. So I think the approach of small things that you can create as a, let's say, manageable curriculum that you, at the end, somehow you manage to be accredited that you accomplished a training program would be a good idea. The other thing, I think, we should see the healthcare providers and the industry as a corporation. So it's a little bit American as a viewpoint, but because there is a lot of continuous education, and I think medical associations are doing that a lot, and they're giving, there's a credit CMS, or there's a credit model. So doctors are acquainted of doing continuous education. So I think that's one topic that we need to address. How do we add points to their continuous education programs so that they get credits for contributing? So I'm not so much well in the academic cycle anymore, so but that's a point that we need to see. Now, we need to educate also, because we're talking about the regulation, the European Health Data Space. This is our environment. So we have to educate also the industry, which is also a huge issue. And there, in some countries, there is some requests that you need to train your employees in a regular basis, and you get some types of incentives like fiscal discounts and things like that. It's not harmonized across Europe, but we need to see how we can use SHIA for corporate training and do micro programs that could fit and educate software engineers, information architects, CTOs, chief medical officers in some cases. Some companies, they operate chief medical officers to consult the technical teams. So there are different roles there. So I think that's something that we need to see how we can contribute to that, I would say. How can we create something that can be adopted by companies? Bigger ones, it's much easier because they are somehow used to do that. Smaller companies that are, especially the innovative one, that is sometimes between 1 person to 20, 25, usually everybody is multitasking in such companies. They have the role of the programmer and the sales engineer in parallel, and they are doing customer presentation, which means the time they really have to educate themselves is very seldom. So, but this is the huge amount of companies. So if you want, because you try to say 100 companies in Greece, if you try to put it in practice, you will have in Greece 5 or maybe 10 big companies, and all the rest are less than 50 people, which means that they are pressured by the system that everybody is working and working to be able to produce something to pay the salary. So it's like a chicken and the egg within the companies. So you really need to find ways to introduce this in the daily routine so that it doesn't put a lot of, because they won't be able to accommodate that. So I think SHIA could innovate in that sense, and I'm really interested to see, and also potentially use Gnomon as a guinea pig in this process, because one thing that even if we are a company that is working in the domain and in theory everybody is educated, if you go down in the more technical people, they are not educated. It's impossible to educate everyone. And some of them, they don't want to be educated. They say, I'm here just to do programming. I don't care about the universe. But in practice, if we manage to educate them and give them a goal and a vision why they are programming and how their work is reused, maybe that would be interesting to see this approach. Now, credits, I don't think they work the same way as in the medical associations for the industry. They have association, of course, so we could potentially reuse them and see what will be their opinion. But it's not, at least in Greece, it's not something that is working so well. And unfortunately in Europe, there are not organizations like HIMSS that give professional certificates of subtype. So one idea would be to see through this micro training, if you do 20 courses or 40 courses of half an hour at the end of the day, and there is an online self-assessment methodology, because someone has to assess that they got the picture somehow, I don't know, an online questionnaire or something like that. Maybe they could get some type of an accreditation, like a personal paper that I was trained, and then now I am a certified professional for the European data space. I don't even know what that means, to be honest. So that's maybe another topic. What do we mean by that? What is an EHDS certified professional? So that's, I mean, is it technical? Is it procedural? Is it what it is?
It's all of it.
In fact, it's all of it. So maybe in theory, you will have to do more than one track of training, one for the very technical people, one for the salespersons, or the business development managers, or whatever. So maybe you need to trigger the interest of the different people. Otherwise, they won't follow so much. And again, we discussed a lot, and the Commission was present today. So from their side, they are willing to find ways to structure capacity building in a more organized way in Europe. They don't know how. So I guess SHIA could be a good input to them, and align them with, be a supportive mechanism, because people are lost with a multitude of projects, and at the end we don't even know which project is doing what. And yeah, some clarity to the people is needed, because we come with all our projects to the community of people that are doing real-life implementations and software developments, and they don't see the difference between ExpandDH, XShare, or XTHR. For them, it's acronyms that they don't mean anything. And some people in Brussels, when we did the other meeting, that came there for the first time, and there were not many, but there were a few, and they were asking me, why do you need 3 projects to do the same thing? I said, no, we're not doing the same thing. But, you know, it's not clear. Yeah. So we should not put Shia as the 4th, another project to do the same thing. So we need to brand it in a way that it's something different and something clear, especially if you want to address the industry. And I guess the doctors as well. And also the nurses, maybe? I don't know.
Yes.
So, thank you.
I'm cutting you. Thank you, Alexander. See, you don't need slides. You have it all in your head. A great head. Thanks for the contribution. Juliana, over to you. I presume you're presenting from your computer?
Thank you. Yes, I am. Can you hear me well?
Yes, we can. We just don't see the slides yet. Okay.
I'm
now,
sharing. Just a second.
Now, I think we have still white.
So good morning, everyone. I'm really happy to be here with you today, although I'll prefer to be there in Athens. I will briefly share with you some, I would say that some learning experience that we have been developing in the past 2 projects that we have been working in. But firstly, I would like to share with you this view, and I'm sorry for being a bit theoretical in terms of education, but I'm really interested in health professionals education, and I spend a lot of time thinking and studying about it. And one interesting thing, and this is a really old paper from '99, that says that a lot of times academics, when it comes to teaching, they go a lot through their opinion and not so much about evidence base. When we translate this to the clinical setting, we understand that physicians, nurses, pharmacists, everyone, they apply the clinical guidance to their work. But when we speak about education, they suddenly transform in other person that goes for the empirical experience, which is fine and is also important, but actually education is a science and should be studied as it. So next slide, please. What we would like to have is something that is opinion-based, but also evidence-based. So a balance between what we think is right, what is our instinct, or also our imagination, our creativity, but also what is scientifically proved as being something that works with the educational purposes. So I would say that we need to select a theoretical framework, adapt to the target, be guided by the target needs, and I'll share with you something that we have done in previous projects. Also be creative and innovative, sure, but also ensure that there's a continuous quality improvement process going on. What happened is that the educational innovations tend to be crystallized in time. People tend to grab some innovation and never let it go. So we really need to be flexible in terms of our understanding of pedagogical needs, and also bear in mind that society changes also affect the way people learn. And we should have that in our mind when we are creating some educational programs. Next slide, please. So I'll share with you something that we have done for ExpandDH. I see that most of you are familiar what ExpandDH was. So the aim was to empowering individuals and organizations to explore interoperable digital health solutions. And we wanted to mobilize and build capacity. And this capacity building was done through the creation of some educational materials. Next slide, please. So we wanted to ensure that the relevant stakeholders have the knowledge they need to apply to the adoption. Actually, it was education for adoption to help the organizations to move forward in their readiness to adopt the format. Next slide, please. So what we have done in terms of education, not only for the health professionals, but today I'm focusing on the health professionals, we went to them and asked them how they would like to learn. And that's something that we don't do often to our trainees, even in undergrad or postgrad, to ask them, how would you like to learn? Because we know that they might be different among different people, but also might be different, and we do understand that in the academia among different generations. So the way people used to learn is not effective anymore in new Z generation and so on. So we asked them how they would like to learn, and they, quite surprising enough, they didn't answer something new. They answered the old methods like webinars, case discussions, workshops, learn from best practices. So we didn't see any, probably we asked the wrong question, or we didn't ask enough, because we would like also to know how long are you able to spend on learning per day. It can be less than half an hour. It can be like 10 minutes while I'm in the car. So, but I think we have done something that is interesting enough, which is asking them first how they would like to learn. Next slide, please. And with this information, we created 2 webinars and a leaflet for the healthcare professionals. We created all other materials to other stakeholders like vendors, managers, and caregivers, and also citizens and patients. But when we created this leaflet for the healthcare professionals, we tried to focus on being short and direct, avoid technical details that won't be suitable for understanding to common healthcare professional, focus on the clinical practice relevance, why this mattered to me. This was the question that we wanted to ask to answer in all our materials. And also highlighting the benefits for the patients, because often when we talk about digital for people from the clinical world, that they are not familiar and they don't want to listen to us because they think that we will be discussing some algorithms, some really complex things. When we bring the focus of our discussion to patients, to patient safety, to quality of care, everybody will listen to us, because then we find the common ground, we find the common goals that we have for our work. So this is a really good place to start with focusing on the patient. Another project that is still going on is the AMR Educare. In this project, we were developing some educational materials for healthcare professionals about antimicrobial stewardship. Next slide, please. The goal of this project was to improve the prescription management, waste management around antibiotics, antimicrobials. The program created an online course based on an educational platform, Lecturio, and have different pathways. And that's also interesting, to be directed to the use of each professional group. So a pathway to medical doctors, pharmacists, nurses, and managers. Next slide, please. We used the framework of the AME, Association for Medical Education in Europe, considered the different learning styles. So we created materials that were different, some written, but the same materials were written or in video or in infographics, so people could choose their favorite way of learning. We used also quizzes to increase learning, spaced repetition, recall from previous learning at longer intervals, and also a question bank that could provide immediate feedback. These strategies are well-known strategies to increase retention and learning. But as we know, to have the knowledge is not enough for action. So we wanted really to translate knowledge into action, into different practical behavior in managing antimicrobials. So we introduced this behavioral change theoretical model that we borrowed from psychology, and also the digital tools that we can use to promote behavioral change, such as telemonitoring, clinical decision support systems, and others. So we try to combine these strategies to make knowledge effective. And something that I would like to highlight today is that it's not enough to transfer knowledge. We really need to translate knowledge into action, knowledge into adoption, knowledge into something that is concrete and real. Yeah, thank you very much.
Thank you, Juliana. Thank you very much for this. Any questions? We're going to have a mini discussion at the end if we have time, but I think there's more information Juliana can share to anyone about these projects, also with examples, I guess, Juliana, some videos. And I guess this material is going to be a good basis also for SHIA, so we don't reinvent the wheel. Any questions from online colleagues or the audience here for the two previous speakers? Everyone seems silent. Yeah, go ahead.
Yeah. So I'm Angelica from the French Digital Health Agency, and of course I share the observations you presented today. I wasn't really aware of this project, and last week maybe on LinkedIn.
Okay.
Saw some
That was the first time we published, yes.
Yeah,
Press release.
really interesting. I don't have a question, but something to share with you. In France, we have an education platform. I'm not working directly on this topic, but my colleagues are. And this is an education platform managed by our agency, and the idea is to improve capacity building. And so we are offering some training.
Mocks.
Mocks. And so the idea is not to produce content for 2 hours of training, but modules,
Bits.
10,
Education
15,
cookies.
20 minutes,
Snacks, educational snacks.
Exactly. So there are many convergence between what you said and what we are doing in France. And so we will be happy to discuss with you and show you what we are doing, discover what you are planning to do during this project. So
No, that is very bite-sized training. That's very good to know, and not surprising because France has been amazing in the last few years in different strategies at national level. Reminds me of our SPMS Academy when I was leading our digital agency, and I guess other NHS Academy. I mean, there's a few initiatives like this. And I think it's good that you're offering to help. I think SHIA needs to position itself on a, this is why it's an alliance, okay? And actually the difference between the word alliance and network is because network reminds us of sort of connection. Alliance means joining efforts towards something, right? And I think here the challenge is the ignorance, right? Ignorance is our enemy. And it's not a small enemy. The ignorance that exists on standards in Europe is tremendous. A few years ago, when we started, for example, the Hospitals on Fire network, you ask around hospitals if they are familiar with, for example, fire, and many hospitals don't even know what that is. When I say hospitals, I'm not talking the doctors or nurses. I'm talking IT. Departments. And I guess if you go to companies, the same would apply even in the testing. We were just talking, me and Alexander, regarding the testing. So having the discipline of testing your software and testing it against others and with others for interoperability. So I think the bridge is to scan what is there, so what is on offer right now, and that is in work package 3. It's one of our immediate activities, is to map needs but also opportunities. And I think talking with organizations such as yours and some universities, some other agencies, we will find two things. We will find needs analysis that have already been done, so we can reuse those, and also some experimentation or some ongoing initiatives. After that, I think it's repurposing some of that material. Maybe it's a great video, it's done in French, and you just get authorization to put it on open license and transform it into 27 languages with some AI tool. And I think this is how we can quickly reuse some material. Others will need to create from scratch. But there, the alliance also helps, because rather than you creating in French a small video about the exchange format or about a specific aspect of the international patient summary, we do it with more than one organization interested, and then, you know, once it's done, it can be reused by everyone with the same logo and the same logic. And then maybe hopefully by then, and that is my question to John, the European Federation finds its energy to also innovate its certification process. Because my question to him is that certification process maybe cannot certify initiatives like this one, which I call distributed education. Like different universities, different organizations produce content that can be reused by others.
Maybe I can give
Of course.
an example of certification that we did.
Maybe you need a microphone so
I
that
can
people.
I can come up and
Yeah.
I don't think there is another mic.
Yeah.
So one example I can give you on certification that we did in EFMI is the 2020 Horizon project, the HostSmart AI. There were, in use cases, a number of people involved that requiring certification of upskilling the skills in artificial intelligence. So what we did is we provided a certification program, a very brief one, very flexible, on 6 modules, giving basic skills in informatics, digital health principles, ethics, and artificial intelligence principles as well. And on the application side, on specific use cases, tools that they wanted to use. So there were 5 or 6 modules integrated in this short program, brief program. And of course, we certified 45 people. Okay. So this is a real implementation. It passed the process of the approval of the European Commission. So it's very important that we have one stamp from EFMI points of view that we have certified individuals, not programs, individuals. And this is, I think, the very first step that we can now expand it to different customized curricula based on the needs.
So we can have SHIA certified trainers.
Yes, of course.
Yeah. So earlier at lunchtime, John was asking me, how can the European Federation help the project since you're not a partner? And I think, and then I was listening to your presentation, and I thought, thank God you're not a partner. Because by being a partner, you would not be able to be, for example, certifying
Yes,
us.
of course. We need this
Or at least,
outside body.
yes. So I think that would be the best contribution, is to not step out, but stay officially out while understanding the project enough, but then go through the certification, eventually adjust it.
We need to be objective.
With a certain independence.
So I think that's a very good approach that I can give you information on the HostSmart AI, how we did it, and also you need.
So you've done that for a project already, Smart for AI.
Yes. Not to certify the individuals only, you need to accredit the
approach.
curriculum of your individual mind.
Of course.
So you need still EFMI for that.
Of course.
Because you cannot go to the association, medical association to accredit. because the field is different. You need people from digital health to accredit the program. So, can discuss
That's very good. No, I think we're building on here. Yeah, go ahead.
Hi, how are you?
Hi.
Martin Hayes from Limerick in Ireland. And I'm an observation and a question.
Yeah,
In
you're free.
I think I'm a member of the SUSA project, which I think was funded at the same time as SHIA,
Okay.
and the idea of synergies and maximizing impact for what we do is something that I think we have to talk about, because that's something for this evening, I think, rather than because there are so many initiatives going on. The idea of there being a one-stop shop or some type of agreed information ecosystem for people to find out about the trainings that are on offer is, I think, really important. So that's just an observation. The question, it's relating to the tension between CPD and ECTS from the perspective of higher education institutions. Because I absolutely get what you're talking about in relation to continuing professional development, micro bite-sized learnings, assessments, closing the loops in some way in order to be able to assure competences. And that these are short, sharp programs. However, from a higher education perspective, we deal in ECTS. I can hire people on the basis of programs and delivering a certain amount of ECTS credits that will contribute to a bachelor's or a master's. And do you see a tension between the two? And if so, how do we resolve it?
No, I think I'm sufficiently naive, okay, to be ignorant to the point of understanding that sometimes things that are rigid could be thought about flexible, okay? What I mean is, I'm not a 20%, 20 years, 100% academic, okay? So I've been teaching in academia more than 25 years, but never 100% of my time. And this means that, okay, ECTSs are interesting. They are interesting approach to measuring what we offer, but they often also are not perfect. So if you were to tell me, okay, what does an ECTS means in terms of hours of contact and hours of autonomous study, X amount of time. So then, could you sum up the bits and bytes up to that time? And you would say that, let's suppose 5 hours of SHIA content would equivalent to another 5 hours of autonomous reflection and thinking, and that would give you an ECTS, let's suppose. So I think that's one way to go. When you think about CPME, and John was telling us about this, I think he's right on one thing, which is where is the direction? So, okay, you could do 5 hours, but if it is 5 hours of half an hour of each silly thing, right? You hear imagine that you have 10 topics in half an hour bits and bytes. And the person just listens to the first half an hour of the 10 topics, never finishing anything. Does this still mean ECTS? From a quantitative point of view, yes. From a purpose, objective, he gained no capacity, no skill, no relevant knowledge. So what we might need to do, and this is, I'm just thinking it out loud, is maybe create a matrix where we have, okay, these are the sort of the lines of teaching, the topics, legal, let's suppose a very super easy one, legal, organizational, semantic, and technical interoperability with different topics within each. And if you want to get an ECTS, you have to do X amount of hours in each of these columns. But if you want to get a credit as a nurse or as a doctor, you have to do some more of the horizontal things. For example, using the patient summary in emergency care. So understanding the legal nature of the patient summary, what are the contents of the patient summary, what are the risks, what could come in the patient summary that is not correct, there's a problem of coding, what are the coding languages, ICD, SNOMED that are involved, and so on. So this means that this doctor is capable of using a patient summary in the emergency room. Now this is creditable in a CPME logic. Correct me, anyone, if I'm wrong, but I think this is. But I see Juliana is raising her hand, so maybe she will correct me, which is great. Juliana, over to you.
I wouldn't dare to correct you.
Yeah, of course you can.
Actually, I think that it's really it's really a key point, this issue, because we tend to confuse, to mess up competence with time. We tend to think that people need to be exposed to something through an amount of time, and then the competence comes after this time-led exposure, which is something that is really wrong. And so ECTS, they tend to think like that. They are I think that is really a low way to put knowledge and capacity building. So we really, I definitely agree that we need to move more than SCTS. They are important for the curriculum. They are the measure of higher education, but we need to think bigger than that. And that applies also to CPD, because CPD is really variable across Europe, really variable across different professional groups. And just going back to what you said, Henrique, is in Portugal, we had really troubles to find ways to credit in CPD points, because we have no CPD process for physicians, for instance. And in the project in Educare, we struggled a lot to have the accreditation here. So two things: CPD needs to be harmonized across Europe so we can think in common frames. And the other thing is really we need to go away from this time frame thinking of education.
Thank you, Juliana. Okay, we have 1 minute to close. Alexander, it's your job to close this session in the program. So I invite you to come to close our workshop. And on my behalf, I'm very happy. I was a very happy moderator of this brief but informative panel. Alexander, over to you.
Thank you. So I think it's an interesting discussion about capacity building, an innovative approach, I would say. And I think that might be, well, we use the word catalyst all the time. I don't want it's a nice one, but it's maybe a way of changing the way we are thinking. Because this is the only way that the European health data space is going to be really, everybody has to go out of the box a little bit. So I also like the idea of taking different projects that are doing the same thing to try to collaborate and maybe exchange notes. So in SUSA, there is also a way of making corporate training in another way somehow, or send students to companies to work on the field. So potentially some material could be reused or so could be combined. I don't know. Let's try to be innovative on this.
We still have a question online. Simon is...
Yeah. Ecumenical. Yeah.
Simon, can you... I don't see the question. French education platform. Okay. Juliana has raised her hand. But there's a question for the colleague from France. What's the name of the French education platform?
It's ANS Formation. I will send you...
Agence Nationale de Santé Formation.
Numérique en santé.
Ah, come on.
Yeah, but I will send you all the details. We have some contents on interoperability, cybersecurity, and also national programs. But it's something evolving.
Simon will quickly scan the internet in French, because he's French, and he will put the link on the chat while we finish.
So one point, there might be several similar initiatives. So making a survey, I think there is a survey about all this. Another thing that we need to put in the radar is that DG Santé and the European Commission has their online academy or something. They mention it somehow. So I think we should try to find a way to push material there, because it's going to be anybody who's registered on the EC portal has access to it somehow. That's a generic recommendation, so it goes for SUSA as well in practice. And they have there their official online training about e-health DSI, which is the basis of the implementation of the regulation for cross-border. So there is also a huge amount of material there.
We have to put our stuff from SHIA in this online commission platform.
That could be a way of supporting.
It's part of
it's part of the thing.
It's part of the grant
Problem
agreement.
solved.
It's part of the grant agreement. Now, what's not the same as having it in a very nice looking, so I think we will need all of it in the EU platform, but also in things like the INS formation and other around Europe. Okay, I like to stick to time. Thank you all.
Thank you very much.
Also my battery was dying. Okay. Well, you have the 6:30 today, but you'll have an amazing day or two in Lisbon on the 11th and 12th of February. So if you like this discussion, if you like this topic, join us for the kickoff. It will happen in Ischte. My team prepared these wonderful slides and I was going to forget. I would be killed when I landed in Lisbon. You can also scan the QRs. There will be hybrid sessions open to everyone, and of course some internal project-related sessions. So the first one is at 1 p.m. Lisbon time at 11th of February, and then at 2 p.m. Lisbon time on the 12th. So these are the open sessions. You can already register so that you can, participate, follow the project, and you can also see the speakers and all of that. And then how can you contribute? Well, just connect us on SHIA on LinkedIn, and we are linking in different ways associated partners. So we are using the principle that I started in Expand the Age, which is open consortium. So we keep the consortium open. This is a lot of work for Anderson. I want to say thank you to him and Simon and Abrar, my vast team at Ischte, that are running our projects, because to get more associated partners, you need to do amendments to the grant agreement, but it pays off to have more partners on board. So we've used this model and we will continue. If you don't want to be associated partner, we are going to create this community of practice, SHIANet, and the Masters and PhD Club. So all the students that are doing a thesis in related to the areas of digital health and the format and the European health data space, we are clubbing them together. We have the first meeting of the club. We have now about 5 students already identified, but the idea is to grow this number very fast, because around Europe, there's a growing number of masters and PhDs on topics related to the European health data space. So we want to capture them all into our club. So why be an associated partner? Access to cutting-edge knowledge and resources, networking opportunities and visibility, and how to become. Just drop us an email, short description, pick number, indicate the work packages you would like to participate, and then we will operationalize this with 3 amendments to include the associated partners. The idea is to deliver, at the end, a tremendously gigantic alliance of partners. Thank you all. I was going to forget this. Terrible. Oh my God. Thank God I did not forget.